Hello everyone, in today's video we'll be discussing about the most common prevailing ailment, which is hypertension. Hypertension is high blood pressure which is for a chronic state. Let's say if it's the BP is 130/90 on the scale, then it is considered to be as high blood pressure. So today we'll be discussing what causes high blood pressure, what are the risks for high blood pressure, what are the symptoms, and with this we'll be knowing the diet and proper lifestyle changes for high blood pressure. So high blood pressure is basically called as a silent killer because it doesn't produce much of symptoms unless it is very dangerously elevated. Okay. So blood pressure has two numbers, right? The top one and the bottom one, which is more harmful. See, the top number is called as the systolic blood pressure and the bottom number is called as the diastolic blood pressure. If systolic blood pressure is elevated and the diastolic one is normal, then it is more common among the older patients, people who have chronically elevated high blood pressure. And if the diastolic blood pressure is high, it is more a common sign that there can be an underlying heart problem. So comparing the two readings, systolic blood pressure is considered to be the more eminent one, which can guide you if your blood pressure is dangerously elevated and it needs to be monitored. The symptoms because of high blood pressure are chest pain, blurred vision, recurrent headaches, nose bleeding, swelling in feet and ankles, and if the BP is high for a longer period of time, then there can be a swelling in the face as well. And apart from these, some patients can exhibit palpitations, chest pain, nausea and vomiting. So the complications in untreated hypertension, when various organs are at risk like kidneys, and if the elevated blood pressure is for longer time, then there are chances for stroke as well. So heart complications, heart problems, kidney diseases, stroke are the major complications of high blood pressure. Basically all these things like the hypertension, diabetes mellitus are interconnected. So if the patient has a chronic state of hypertension, then there are chances that they'll be having diabetes mellitus in a near future as well. People who are obese, having high BMI, people who have a positive family history of hypertension, people who take alcohol, people who use tobacco, and all these people who are more exposed to air pollution, all these people are more prone to hypertension. Looking into the dietary guidelines, the first thing is eat less of sodium. So the amount of salt intake per day should not exceed more than 1 teaspoon. Eat more of potassium rich foods, which can help in reducing the swellings. And finally, eat less sugar. The first thing which I recommend is more of wall sits. So wall sit is one such exercise which instantly helps in reducing the blood pressure, and so is breathing exercises. So these two are the basic exercises which help in reducing blood pressure almost instantly. And apart from this, 75 minutes of high intensity workouts can help in reducing blood pressure, and 150 minutes of moderate aerobic exercises can also help in reducing blood pressure and maintaining it. The best 4 home remedies for high blood pressure are, the first one being coriander seeds. See, soaked coriander seeds in water is considered to be the best in case of diuretics and in controlling high blood pressure. Apart from this, gooseberries, the amla which we use, even that is very beneficial in controlling blood pressure. Black pepper, if taken in our general beverages, can also help in reducing blood pressure. And garlic is also helpful, but garlic accounts for only 9 to 12% of reduction in blood pressure. I hope this video will be beneficial to all those who are suffering from high blood pressure, and stay safe, take care, thank you.